cancer,
long-term nutrition or something.
okay, long-term nutrition, sickle cell, a couple different reasons for poor. So that's what it looks like, okay? It's kind of a soft center, not really, but that's one thing you really want to do when you're practicing is like touch these things, you know, see what they feel like. Because you go in and have to do them on a real patient. So you're always going to be able to kind of see or feel it through the skin of a patient, which is nice because you kind of know where you're going. They could have a double, which is just two little, I'm forgetting, the septum, two little septums next to each other. Okay, so then you probably access both. Before you get started, obviously, you know, you have to have a mask for the patient. Yours comes in the kit, so the patient's going to need a mask because even though it's just skin right here, once we access it, obviously it's done with sterile technique. The supplies you will need a 10 ml syringe, maybe multiple if you need to draw blood. That was last semester. We're just keeping it simple, but just to be thinking. You'll need a 10 ml syringe. You'll need a Huber needle, H-U-B-E-R, H-U-B-E-R, a Huber needle, and it's a needle that looks like this, okay? So that's gonna be what spikes in there. They come in 1 and 1.5 inch, and so it's helpful if the patient knows. If not, we go shorter rather than longer. The problem is if you don't get blood, then you might need the longer one. So it's helpful to know before you stick the patient. It's kind of like an IV poke. We're just going through skin, so it's not extremely painful. The problem is it's all in the same spot every time they get it. So it's not like we're rotating. So that's one of the things. All right, you need a central line dressing change kit, which could come with a ChloraPrep. The reason that there's a separate ChloraPrep here is because this one didn't come with it. So I'm kind of adding that. And then you need, oh, my little thing that came open. And then you need a cap. So the caps all look different. At the hospital, they look more like this end, like the white with the blue. Ours happens to be red and look really kind of not sterile at all, but it is. I promise. All right, your mask is in here. Alcohol swabs, all that stuff is in here. So you gather all your supplies, you explain to your patient what you're going to do, check 2 patient identifiers. We're doing this either to draw blood and provide nutrition, fluids, whatever, or to give chemo treatments. My hair obviously will be up. This is really weird. I have like not good clothes on. Okay. Obviously, I would have more workspace too. All right, so the patient's area is already exposed. If the patient's sweaty or dirty for whatever reason, I can clean that with alcohol or a washcloth before I get started. But I'm going to open this. Okay, this is a sterile thing, and I usually just take the whole little package out. I don't like dealing with all that stuff. Okay. Sorry, it's the ER in me. So we're gonna just open. Remember, you have a 1-inch border that you can touch. Okay, and I'm still touching the outside.
Okay, so I'm gonna come in and I've done all that. I identified him.
Now what am I gonna do?
His name, given him information. So I'm gonna go ahead and bring in.
Wash your hands. Yes, wash my hands. Okay. Anytime you put a mask on, then you need to gel. Okay. I did that when I came in the room. I didn't say it, but I did that when I came in the room. But after you put on a mask, then you need to sanitize your hands. So I have that close to you.
The patient already has their masks on at this. Has their mask on at this point.
You can give it to them if they're able to put it on. They don't have to put it on yet until we're ready to go. If they're not able, we'd have to put it on before you get sterile, and they'd have to stand on it. Okay, so then we've got sterile gloves, which I'm not going to put on yet. Put those on my bigger workspace that I don't have.
You said we could just use the gel after the mask. We don't have to wash hands, or
right? If you wash your hands really good when you come in, or yeah.
Okay,
So as you can see, it's not really a complicated kit once you get in there. It's alcohol swabs, iodine, which we don't use anymore. Some of the kids still have that stuff. And then a big tegaderm. Okay, so I'm gonna have to work on the other side of, without my shoes, on my sterile field. So now, if it didn't come with a ChloraPrep, I would drop it on. Oh, see, I'm not good at dropping. Pretend that really fell in the middle. That would be in there already. And then I have a Huber needle, which has to be sterile, okay? So I'm also going to drop that on.
But I also realized too.
And then I've got this little cap over here and this saline. All right, so I'm gonna open this. This is sterile. Okay, and I'm going to, gosh, I'm touching everything. This is a great video. I'm not touching the sterile tip though. Okay, so why am I doing this? I will show you. You want absolutely everything that you can touch with bare hands done that's not sterile before you have to be sterile, okay? So this is still sterile. I'm gonna flush it a little bit. So when I put on that cap, I'm good to go, all right? So any questions so far? Mask, washed our hands, open the kit, drop things on that you need that have to stay sterile, okay? So this is where it's fun because I don't really have any room. Okay, so you get a separate cap, we have that already. I'm gonna come over here just because I need space. At this point, I'm gonna put on one sterile glove and I will show you why. You'll have to figure this out for yourself. I'm going to put on my left glove, okay, because I am right-handed. And I will show you why. This is where practice really helps. Wow.
Okay, once that's out, I'm going to go ahead and take off my gloves.
This is going to happen to you because all your kids have been in the back of your car forever. Wow, do you see the mess there? Okay, so I'm going to put on my left. Okay, because this is non-sterile and that's sterile. What do I have to do with my saline? I have to flush that before I put that in them, okay? Now, in the perfect world, as soon as you put that in, you could just attach a syringe and draw back blood. But what if you don't have blood? Then you have to flush and try to draw back blood. So I always flush my line. I don't depend on blood coming out, okay? So at this point, I'm sterile, so I can grab this. I'm gonna get my cap off of this. Okay, and now I'm sterile, non-sterile, and right here, oh, I did the wrong end. No, I didn't. Okay, and now I can flush this, except my clamps are on. Ah, my glove stuck.
Putting it up underneath so you can go ahead and have a sterile area. Now, if he was someone who really had a concern, I should put the oxygen vent on. Okay, that was one thing I should put that. So when I'm opening it up, if I'm doing it right away and I'm pulling it up
Is the
and
black
putting it on,
block?
that's fine.
No, they're open.
But other than that, you would put it.
Is there air still in the syringe preventing from
So,
going?
It might just be because this has been used before,
both my hands are still sterile.
and if they use something with dextrose in it, it's not gonna go. Okay, so I'm flushing. I promise I am flushing, and I'm gonna not stick myself.
I'm gonna go ahead and pour both of these.
Okay, so this is the purpose of this, is to flush that. So now, we're gonna lay that on our 1-inch border, and the rest of it stays sterile, okay? That's the little trick. This is still sterile. I'm gonna come over here with my crazy messed up glove. Okay, sterile gloving is probably the thing that people mess up on the most. You just have to get comfortable, okay? Okay, so now I'm ready to go. Mr. Smith, I'm gonna clean your port site now. I'm gonna crack this. I'm gonna come over here. And I'm gonna clean. How long am I gonna clean? 30 seconds, okay? Now, you probably still learned like go out. It's actually back and forth. New research is showing back and forth over and over to clean that area. Obviously, if they've got dirty skin, you want to spend the most time here, and when you're done, do that on the way out. But at first, you're scrubbing that area. Otherwise, if you just do this, what are you really cleaning for 30 seconds? Everywhere except where you're putting it in.
That'd be the same like for central line dressing when you do.
Spend a little time on the area. Yeah, spend a good 10 seconds on the area, and then you can start going out. This is really dusty. Okay, so we're done with that.
You showed on this side, you couldn't see.
I'm sorry, I already threw it on the floor. Okay. So, hey, Mr. Smith. So I'm cleaning, I'm spending a little time on this main area, okay? Back and forth, really scrubbing the area. That's the purpose of it, really. And then when you're all done, go out. Okay? All right, and now we're ready to go in. So this skill itself is like 2 seconds, okay? It's just all about how do I get that on that without breaking sterile field, okay? So I'm still sterile. Here, let me know. Oh, sorry. Can you all see over my head? So now I'm gonna reach in, I'm gonna grab this. And this can kind of drag. Remember, the patient actually has a body. So we're gonna grab on both sides, okay? And this is sterile, but this is a sterile cleaned area. Okay, so I'm gonna grab this, and I'm gonna go, can you hold the back of him and peer over for me? Okay, so you're grabbing, and you're going right in, okay? So I'm sterile, I'm touching sterile things. Now I'm gonna break sterile field, and I'm going to flush, pull back, get some blood. I'll have to talk to Crocodile about that. Pull back some blood. And then I can kind of leave it here, okay? And go get, this is still sterile. Really, both of them are still pretty sterile, except this one. But I'm just gonna touch the outside. And I'm not really gonna stick it because we're gonna reuse that. Okay? And then you can do everything else that you wanna do. Like, you already have your cap on, you can clamp, you can draw blood, you can do whatever you need to do. Anybody not see? So, who wants to review? Tell me the points.